A growing number of healthcare workers say they're under attack and they need the law on their side.
Our 10 News anchor Lindsay Pena shows us how one San Diego nurse who was brutally assaulted on the job is now fighting for change. And we do want to warn you, some of the images you're about to see may be disturbing.
These pictures were taken right after Mary Prehoden was attacked last summer.
The whole thing probably took less than a minute and a half.
She was on the 8th floor of Scripps Mercy Hospital, where she works as an operations supervisor, when she heard a man screaming.
And he just came right over the chair, punched me in the head. My glasses ended up 3 or 4 feet away from me. He had a hold of my hair. He bit me. He punched me. He kicked me. He tried to gouge out my right eye. His actions were deliberate.
Prehoden relived those terrifying moments in court. The man responsible was sentenced to a year in prison, but only served 6 months. The whole ordeal inspiring her to join the fight in pushing for tougher laws to protect healthcare workers.
I feel like I'm the face now that carries the voice of 1,000 people who said, it's happened to me, and I'm frightened.
She told her story again in Sacramento last month before the Public Safety Committee in support of AB 329. The bill would stiffen the penalty for anyone who assaults a healthcare worker inside a facility, making the mandatory sentence up to a year in jail and up to $2,000 in fines.
We need our legislature and law enforcement to recognize that this is a growing issue, and we need their help and support.
Scripps Health CEO Chris Van Gorder says across their facilities there were more than 800 incidents last year, 24 of which were classified as significant assaults, which means they caused the employee to miss work.
Violence in hospitals is not new, but it is on the rise.
To deal with the uptick in violence, Van Gorder says Scripps has made a number of changes, including implementing a screening system to easily identify which patients might be prone to confrontation. All employees are also required to take de-escalation training, and some of the security guards are now equipped with tasers.
Every nurse that I know, in nursing for 39 years for myself, has been assaulted.
Prehoden is hopeful sharing her story will help the public understand what goes on behind closed doors and why she and other healthcare workers are hopeful something will be done to change it.
I certainly never would have chosen to be the face of workplace violence. But something good will come from this, and a lot of good things have come from this.
Lindsay Pena, 10 News.
The hospital violence bill was passed by the Assembly Public Safety Committee. It is now in the hands of the Appropriations Committee.